Alrighty. So thanks, Michelle, for jumping in at the last minute. We're live here on our public Facebook page. And I guess I want to also, there may be some folks who have not met you yet. I'll let you give a minute or two introduction for yourself there.
All right. Hey, guys, I'm Michelle Damone, and I reside down in West Palm Beach, Florida, your neighboring state. And I'm a former local elected official, 4 terms. I served a nonpartisan seat, presided over 40,000 residents were my constituency. I probably learned the most in the election that I lost. Been very involved in our surrounding communities as well. I was chair of our Western Communities Council, which is 7 different communities. I've championed some state issues, particularly State Road 7, and I still do. I was involved in Tropical Storm Isaac. I had to work with then Florida Governor Rick Scott, and get some funding back here, $4 million. And I've taken on Aaron Brockovic. I know that can be a plus or a negative for some, but if you have a legit concern and she shows up, great. If you don't have one that's being exploited, having her come in your hometown is not necessarily the greatest thing. And I just like being involved in my community, and I'm in a role right now where I feel like I can assist others. I'm mentoring a couple of young Dems here in Palm Beach County, and I'm enjoying that role. And I'm really looking forward to meeting each and every one of you. I know I've met some, but I like getting involved in Georgia politics, but more importantly, seeing everybody's involvement in your group is what has been inspiring. Each of you have shown up for different reasons, but it's incredibly inspiring for somebody who's been around as long as I have to see what a large, diverse group that you have that wants to be involved in our next election. So That's a little bit deep.
And guess who just chimed in? Rachel Kinsey. So thanks for joining, Rachel, and thanks for the intro there, Michelle. I had an idea with Michelle earlier today that we would sit down and talk healthcare, because whether or not the Republicans decide to make this their issue in 2020, because this changes from, seems like, hour to hour via Trump's tweets. What that could mean. There has also been some, I'd have to go back and look to see if Kemp actually signed it, but there were also, Medicaid expansion contraction issues here in Georgia. And I can even go into a personal story, from about 6 or 7 years ago, or even longer, before Obamacare and those types of issues. So I guess we'll start out, if we talk about healthcare, I think most of our members, and hey, Laura as well, most of our members were so, concerned, and rightly so, about House Bill 481. And I know that you were doing some intel and some work about what was going on with 481. But where is that right now?
House Bill 481?
Yeah.
Which is Senate Bill 218. It passed. It passed on, I believe it was March 29th. It passed the House again. It had to come back because the Senate amended it, and so the House had to come back and reaffirm it, basically, which is interesting because that vote came in at 92 for it, 78 opposing it, and in the House, for a bill to pass requires 91, I'm sorry. And so it only passed by one extra vote than it needed. 5 Republicans crossed party lines to oppose it, and but now it's going to Governor Kemp's office to be signed. And after a tweet, I believe he wrote yesterday, I don't see him vetoing that bill. So I believe that House Bill 481 will become law in the state of Georgia, but I think before it becomes law, it's going to be challenged.
Yeah. I mean, the ACLU, I've seen the messaging coming from ACLU. They already say, we'll see you in court, Kemp. So,
yes.
Yeah, and Laura's saying as well that one Democrat voted for it as well. And I did see the note and messaging about him. It's almost like, that with literally passing by one vote, it's almost mechanical at this point. That that they call around all the different influential members and the caucuses, and then they're like, okay, we got it. Let's go and run a vote now. And it really is disturbing. One of the things that why I wanted to do that this session this week, I'm actually working with one of the provincial health services up in Canada this week and next week, and it's been very interesting as the facility that I'm working at is I'm walking through a Canadian hospital. And just kind of in my mental note self, just trying to compare the health services up here versus what we have in the U.S. Honestly, there don't seem to be much differences at all, except that folks up here, it's pretty much built into their taxes. And I have kept saying over and over and over again that who complains about Medicare? I mean, Michelle, do you hear any complaints about Medicare?
I don't hear complaints overall other than seniors. A lot of seniors will have some supplemental policies, but you will hear seniors fight for Medicare before they will oppose Medicare.
Yes. I mean, my very conservative uncle around the holidays was just praising. He says, I love Medicare. But why is it that we have a certain segment of the population, okay, that they've worked, and I, every day work to pay into that fund, but yet, come hell or high water, are the politicians going to do anything with Medicare, or are they? There are these, concerns that, you hear some of the, probably more so on the Republican side of the aisle. They say that, well, we can't afford all this, but yet they want to go off on increased spending on the military. So, what are your thoughts on some of those issues?
Well, I truly believe I saw some initial reports last week where Trump administration was looking at reducing Medicare, and for savings. I want to say, was it $6 billion that they proposed? And that reduction would reduce services among our elderly who are already on a tight budget because they're living off an income that was designed from their youth. And so if the Republicans continue on the path of threatening to reduce Medicare, I believe it will be one of the top priorities for seniors going into the 2020 election. I think health care is going to be a huge issue in the 2020 election, but I think the seniors, you will see them come out and vote historically if the Republicans continue to threaten Medicare.
Yeah. And on that topic, I will let our members know and all the folks in our area that disagree with us, we have a game plan for that. I don't know that I want to release the full details of it, but it may incite violence in a retirement village.
Well, so fun.
I mean, and we even saw this back when we were doing billboards leading into the last election. When you say something or you hear a different narrative or you hear something different, and it actually, by the way, is the truth. A lot of people on the Republican side of the aisle, either they don't want to say the truth or they don't want to hear the truth. But when you rouse these suspicions out there, it's kind of game on. And I mean, there was an example of one of the ads that we had running on Facebook last year. And Marv and I, we were watching some of the posts and comments, and literally, I believe it was this lady commented on the healthcare post and tagged like 4 or 5 friends and said, is this true? And yes, I mean, I cannot, correct me if I'm wrong, but I think everything that our group puts out is truthful. And yet even Rob Atkerson, who is Barry's chief of staff, has come back at us and say, you are not putting things that are true out there. Well, Rob, meet with us and let's discuss that. And by the way, that has not happened yet. So, I mean, and we have examples of things that Barry Loudermilk has run, on his platform and in his positioning, and going back out there to all of, and he literally holding up a sign that says defund Obamacare. The Republicans never had any interest in supporting the ACA and Obamacare, and that is clear still to this day. And I think when Trump, whatever he happened to be doing, and he decided to tweet something and it caused just myriads of all these different news stories, I think the smart Republicans went in there and was like, no, we can't do this right now. We already look bad enough. Why in the world will we do that right now?
Well, here's what's interesting about that. So McConnell went to visit Trump after Trump said that they were going to have a replacement. Because remember, Trump's repealing Obamacare. And what Americans are scared of is, okay, if you repeal it and you win, what do you replace it with? So Trump said that the GOP was going to replace Obamacare or the ACA before 2020, and then came out after Senator McConnell came to visit him and warned him that it could not be done by 2020. And I'm sure there were some other political discussions like, you just put all of us Republicans' feet to the fire now. Thank you very much. And so Trump came back out and retweeted that it would be that his campaign promise was to repeal it, and his new campaign for his second term would be to replace it. So he has assigned 4 senators to come up with the replacement, and one of them is being newly Senator Rick Scott, former governor of Florida, who was a businessman before he became governor, who was in the healthcare industry. Very successful, made a lot of money in privatization healthcare here in Florida. And so I thought that was interesting that he's one of them. I'm trying to find my notes on who the other one was. One was Senator Lindsey Graham from South Carolina. And 2 of them are doctors, John Barroso and Bill Cassidy. But it's Rick Scott, former Florida governor, and Lindsey Graham that are going to be on that committee to seek a replacement after 2020.
So immediately, sorry, go ahead.
No, I'm sorry, I got a little excited here. And that's the Republicans counting on that they win back the House and the Senate and have both in 2020. So
we can't let that happen. But immediately when you said Rick Scott and you said the word businessman, who does that remind us of?
Well, yes, you have one of those in your state too.
Maybe the guy named Perdue. I mean, and we should also remind everyone that his family member Sonny Perdue is the ag guy on agriculture guy on the cabinet. And I still don't understand if they either own or part of Purdue Chicken, but I always think about that and that. Purdue does not do town halls. That's not his style. Bless his heart. So, I mean, this is all very interesting, and everything that I have been involved in with politics is that Trump just always seems to be a wild card. It's just, well, what can I tweet right now to get me the most, top of every freaking news story out there? And I mean, and you could try to argue that the news media is, doing more bad than good. I don't know where that is right now. But, getting back to healthcare, it just, if you have to sit down and explain what the impacts of these things could be, I would even go back and talk about when my company shut down in 2009. And I had a private health insurance group plan for my employer. That was before Obamacare and the ACA, if we want to do a little bit of a history lesson. And my company completely shut down. And there was no COBRA. The only safety net that was available at that time was to go to the state of Georgia, and they have what they call high-risk pools. And I think most of you that know me, I'm not the most in shape person, and so the last resort was literally going to one of those high risk pools, because insurance companies, if you do a private plan, pre-Obamacare, pre-ACA, they only wanted to insure less costly people that were very fit. So, thankfully, I landed a new job about 2.5 weeks later, and I didn't really have to deal with that because of the way the laws are reading everything. But it's scary. And how many people, maybe in your family, close family or friends and stuff that have had to go, and declare bankruptcy over medical debt. It is mind-boggling that the whole quote healthcare machine literally leads to bankruptcy.
And here's the other half of that is the threat of removing pre-existing conditions.
Mm. Yep.
And that would also become costly and could possibly bankrupt somebody over financially over time on something that maybe stem from their childhood or their young adulthood and comes back later on. I'll give you a personal example. When I was 15 years old, I was in a major car accident, and they told me, hey, you got a little fracture here, you'll be okay there, go see the chiropractor, and you'll be great. So 30 years later, I have all of these conditions that stem from that car accident, and who would have seen that coming? And they were unforeseen. Those type of conditions can be threatened with the replacement if the replacement doesn't protect pre-existing conditions.
Yeah, it is cool. It comes back down to there were news stories that covered this. They didn't have a plan. And so that's why this is literally, I think one of the stories I saw, it's really punted off to 2020 now. These things don't change overnight. There are tax implications. There are, I have a friend that works in actuarials, if that's the right pronunciation of it, but they look at a complete group of people that are going to be insured and before they rate it, and they look at their past claim history, and they make estimates for, the next 1 to 3 or 5 years, how much are these claims going to cost. And so the other thing, too, that I was going to mention is, my employer has pushed me into an HSA, health savings account, high deductible health plan. I'm very fortunate to work for a really good company. And even though it is one of those costly, plans, my employer contributes money, to that. I think a lot of companies have moved towards that. Does it cost me less? Maybe. But you have to look at continually over the numbers of years in order to keep that cost as low as possible to, people that are paying for it. And heaven forbid you have to, cover a spouse or a family, with kids. But if you really sat down and look, our healthcare costs have not gone down. And everything that, that they try to, I know one of these other little stopgap plans that they want to be able to sell these cheaper insurance policies that don't cover as much. Okay, so you just buy one of those and hope you don't get in a wreck, or you hope you don't get sick, or all these. It doesn't make sense. Why does healthcare have to be this complicated?
Well, there's something. So people have concerned. Number one concern in healthcare is high premiums, and the second concern is high deductibles. And one of the other concerns that folks have are surprise bills. Mm-hmm. So if you get one of those policies that you're speaking of where there's less coverage, you didn't read the fine print, but it was something you can afford. You could be out of network. It could just be something that it wasn't covered, and now all of a sudden, surprise, you've already committed to the test or you committed to the procedure, and you find out that that's the portion of the hospital bill that you are responsible for. And so, yes, number 3 on their list is surprise bills. Mm-hmm. And that's what's going to happen depending on where we go in the future. If we start chopping this up into pieces, trying to make it look affordable, is we may end up with something that looks glamorous on the outside that has devastating results that we didn't see coming.
Yep. It's like the Little Shop of Horrors. And we can go even into more detail. I mean, there is a member of our group who was in contact with Barry's office and his staff. It was basically told to him that if you don't like it, you need to go run a GoFundMe page or ask friends and family to pay for your medical bills. I mean, literally, these are the responses we get from our so-called elected official. I also was working with another staffer who works for Barry, who said, "Well, I'm a man. I don't have kids, so why do I need to pay for maternity coverage?" That's not how this works. It's almost like that commercial where the older lady is trying to get on Facebook and she's putting photos on her wall of her home. That's not how this works.
Well, it reminds me of what I used to hear when I was knocking on doors 20 years ago, is my kids are all grown up. No one goes to school anymore. Why do I have to keep paying the taxes for school? Well, do you want an educated population, an educated workforce? Same thing. We want healthy neighbors.
Yeah. I mean, I went to all public schools in Georgia, and we don't necessarily have to take that off to that tangent, but I mean, I never had to go to private school. And this whole thing of, us versus me and all, oh my Lord. I mean, what literally just changed in the past couple of years? Maybe it's pocketbooks, maybe it's promises from politicians, I don't know. But I don't understand why this all had to go changing and pitting people against one another. You're going to pay the damn thing anyway. If you take healthcare away from low to middle class people, they're just going to go to the ER and we're going to have to pay for it anyway in taxes. So why continue to go back and forth and cause all this havoc, the undue drama and, suspense on all these people that are affected? It boggles my mind. And so if I'm not mistaken, it's the Medicaid expansion bill here in Georgia. That has also
on Medicaid. Mm-hmm.
Yeah. So has that also gone to Kim to sign, I believe?
I haven't followed that bill, but I do know that the GOP is looking at less money, putting less money towards Medicaid, which will directly affect low-income families. Let me see.
Yeah, and the discussion that I remember going on about that was it was all touted that, if I'm not mistaken, here in Georgia, they wanted to lower the Medicaid income level. That just takes more people off of Medicaid and sends that whole thing into a tailspin. So you just wake up every morning and hope you don't get sick. That's the GOP medical plan, and it's just insane.
It is. As much as the older population struggles, because with Social Security or whatever funding that they saved for them was based off an income that was 60 years prior or 50 years prior. The youth, the younger, the lower income can be starting families. It can be young families, and then they need the Medicaid for their children. They need the Medicaid to give birth, a healthy birth. And so if we tackle Medicaid and we're going to isolate an entire generation of folks that really need the most help. When we're talking about higher paying wages, livable wages, you can increase minimum wage all you want, but as soon as you get that one medical bill or you have that one surgery you didn't see coming, it doesn't matter how much livable wage you increase because that medical bill is just going to take them away from any balanced budget within their home. So this attack on Medicaid is a whole different conversation, and I think it's an assault against low-income families personally.
Yeah. I mean, it just goes back to, the way Rob Atkerson responded to our member, and he said, ask your family and friends to pay for it or do a GoFundMe. Just the asinine stuff that comes out of their mouth is just mind-boggling. And when you confront them and go back to them, it's just crickets. There's no response. Actually, we have that recording if you want to. It's on this same Facebook page. Barry and Rob think that they have done their due diligence and they have dealt with us as a group. No, I don't think so. We're continuing our strategies. We even go back and we have also video of Barry trying to get votes years ago and meeting with the Planned Parenthood baby parts guy because he had to change his tactics in order to win. Well, keep hitching your boat to Trump there, and I don't know how much longer that's going to last.
So you want to hear something funny since you brought that up? So I'll give you guys a little Palm Beach tip. So since the winter White House is located at Mar-a-Lago in Palm Beach, Florida. Many people over the years have visited Mar-a-Lago. And if you're a Dem in this county and you have your photograph taken with Trump or at Mar-a-Lago in the last 10 to 20 years, it's going to come back and haunt you in an upcoming election. So I just found out today that one of our high-profile elected officials in Palm Beach County went to Mar-a-Lago last week, and he's a registered Dem and had his photograph taken. And I'm telling you, it is like muck in Palm Beach County. So that's my little fun tidbit for the Trump 2020. It's going to be interesting. I think I sent this to you to share with the group up on the Panhandle, which sometimes can reflect our northern border can reflect a lot like Georgia. There is a woman up there that ran for office, and she ran on the chant of pro-guns, pro-life, and pro-Trump. So this is what's coming in 2020. It's 2019. I know the Florida Democratic Party is well organized quickly here in Florida, getting ready for Trump in 2020. We have Andrew Gillum, which is like Stacey Abrams in Georgia, both high-profile Democrats that are moving the country in the right direction. Both lost their election by close margins, and Andrew Gillum is challenged through a nonprofit organization to register 1 million new Democrats for preparing for the 2020 election. I'm sure we'll see Stacey Abrams make the same pledge soon for Georgia, but they're definitely gearing up for 2020, and we all need to be prepared. So a visit to Mar-a-Lago will probably get you unseated if you live in Palm Beach County. Anyone who supported House Bill 481 in Georgia, I think is going to get you unseated in 2020. Anyone who messes with Medicare is going to get you unseated in 2020. There's some. Trump is helping us Dems, believe it or not.
Yep. He just continues to press any buttons. I could go on to some other potential things that he might try to pull, but it is so clear. Every time, negative news comes out, he's always trying to wag that dog and send a direction elsewhere. I hope I can say for all of our members, we won't forget. And for sure.
Well, I don't think Trump's going to let them forget. I have this funny saying, I think Kemp has a backbone to Trump in the White House. I think DeSantis here in Florida has, a back call to the White House with Trump too. Georgia is going to be a key state in the upcoming 2020 election. We can already tell by some of the seats that the National Democratic Party is focusing on, both in Georgia and Florida. So, we need to prepare. Indivisible 11 needs to be well prepared. This group who are all so diverse and so energized to want to serve and to make a difference and become influencers in the 2020 election have a real opportunity to make a difference and to make sure that Trump doesn't get elected in 2020, and that we hold some of these House of Representatives and Senators accountable for the decisions and choices they just made on behalf of Georgians during this 2019 legislative session. And, I want to be a part of something where we make a difference in the 2020 election. Whether it's here in Florida or working with your group in Georgia, I hope that history writes that our two states, or one of the two, is the one who unseated Trump in 2020.
Yeah.
And you never know, a whole section of folks like in the GA11 up in Cherokee and Cobb County could be the difference makers. Unfortunately, Palm Beach County has been on that map a few times. And so, I know people make reference to Palm Beach County. So maybe, going in 2020, Cobb County or Cherokee County or a combination of both will be in the history books for the right side. Maybe that's where the deciding votes are if Kemp doesn't go in those little magical new machines and hit a button, since we can't track ballots by paper. We have to do it by barcode and trusting our elected leaders in the state of Georgia now. But that's a whole other conversation on House Bill 316.
Oh, yeah. I think he just signed that. Was it today or yesterday?
I think it was yesterday he signed it.
Yeah, and I don't know that it actually named the vendor, but there is a interesting connection to one of the voting machine vendors, and yeah, that's going to continue because Raffensperger has no interest in changing anything than what Kemp was running with. So.
Well, you had Kemp as Secretary of State, and he was assigned the task of looking for new equipment for Georgia, and now
Allegedly,
he is. And so I think the RFP went out written to seek providers for that equipment, but we already know one of them that's going to be on there. And I think if you follow some PAC money and campaign contributions, the trail will be clear.
Mm-hmm. Yep. So, is there? Well, let's talk about some maybe 2 or 3 action items to kind of wrap this up a bit. House Bill 481. I mean, we could try to say that it's not going to happen, but it's basically just give them hell. I mean, and take names literally. I mean, I know that my state representative Sharon Cooper, she allowed it, to go to hearing. I mean, it was her committee, but yet in the end she ended up voting against it because she saw that it was patently, just unconstitutional.
Well, I think House Bill 481, it's going to be challenged, and like you and I spoke about earlier, it'll be challenged by the ACLU. So I think it'll be caught up in courts. And then if for some strange reason it became legal, it'll be short term, because I think 2020, I believe that the women in Georgia are going to rise, and I think they're going to choose their gender over their party. And if this continues in other states, and they're saying that Florida, Missouri, Ohio, Tennessee, and Texas are going to follow after Georgia if this bill passes. Mississippi and Kentucky already started signing measures that are similar. But if this continues to happen, it'll be short-lived, because I truly believe it will be one of the number one topics next to health care. And this does relate to health care, and we haven't even talked about that. But it will, the women voters are going to truly decide our next leaders in 2020. And this House Bill 481 is the one that's going to light the nation on fire, not just Georgians, the nation on fire. You see that Alyssa Milano was in town. She was in the Capitol building 2 days ago. She has a petition. 60 actors are on it to say that they would remove all of the film industry, the Hollywood industry out of Georgia. You had the Oregon governor yesterday, who is a female, said, "Come to Oregon, we'll welcome you here." Mm-hmm. If you lose that industry, which is a billion-dollar industry for the state of Georgia, you're going to have a lot of Georgians rise on that one. You're going to have both genders rise upset over that. So there's a lot more to be played out with House Bill 48, and I think Georgia is going to be the lead nationally. And this issue is going to become a major national issue going into the 2020 election out of your state.
Yep. It just the scary times these are. I can't. And maybe I'm just older. I don't know, but I have never seen the politics as they are right now. And I can only blame Trump. Even the Republicans going up to the nomination, they said that he's never going to be there. I think there was even video of Ted Cruz saying that Trump's not going to be the nominee. So,
well, it's funny, is leading up to the 2018 election, I have a lot of Republican friends. I try not to choose my friends by my party, but once in a while they like to pick at me because I'm one of the only Dems, but I can stand up for myself, no problem. So one of the questions they asked me leading into the general 2018 is, why are you a Dem? What is the number one reason that you're a Dem? And I said, the number one reason I'm a Dem and I'll never change is for pro-choice. And they laughed at me. Now, this is during the Kavanaugh hearing, so this is not that long ago. They laughed at me and they said, Michelle, that's not a non-issue. Roe versus Wade will never be turned over. You will always have pro-choice. So here comes House Bill 481 that was introduced on February 25th in Georgia. And it is a sneaky anti-abortion law, okay? It's very sneaky. They might as well just say, hey, we're anti-abortion. So they have this heartbeat bill that says about the 6th week, if we can detect a heartbeat, you're no longer, it is no longer legal for you to have an abortion unless there's some issues that relate to a woman's health, to the health of the mother. But overall, basically, it is an anti-abortion law. And they snuck that in. And it passed through the House in the first day. And then it went to the Senate. And then I think your Senate leader in Georgia got a little scared. And so he delayed the vote by 3 days. And I think that's because that's when the public started catching wind of this. But this is that anti-abortion law. A woman isn't really going to, especially if it's her first time being pregnant, going to figure out that she is pregnant until she's almost 2 months, when she misses that second period. And this is an anti-abortion law. Call it what it is. I would have more respect for you than sneaking through the back door of something like this. And I was shocked when I saw the photo on Twitter of your Senate with one woman standing proudly among all the men over this bill. And it's shameful because it was sneaky. But call it an anti-abortion law because that's exactly what it is. So my Republican friends were wrong. That was just in October of 2018. And if that bleeds and comes here to the state of Florida, I promise you I'll be up at the Capitol building.
Yeah.
It's a 7-hour ride from here, but I will be there. I believe in pro-choice. I think people need to go and read history books. Watch the movie Cider House Rules. You're going to have women go back to these barbaric ways where they drink bleach to try to give themselves an abortion. We won't even talk about clothes hangers, but that is a reality. They will have unhealthy abortions. But here's one step further that the Georgia lawmakers took. They criminalized abortion. So if you have a scared 15-year-old, maybe she comes from a very strict home, and she's scared and she wants to get this abortion, so she attempts to self-terminate and she drinks bleach because she's a hot mess, she can actually be charged with homicide of her unborn fetus. So that's the second step in this House Bill 481 that Georgia took. And this was very sneaky, backdoor anti-abortion law.
Yeah. And I thought Republicans were for less regulation.
They keep saying that, right? Unless it interferes with their game plan. But yes,
yeah.
No.
So, yeah, appreciate, all the help. And, I mean, we could probably go on for hours, but not everybody has hours to spend on this every day. I just want to recap, for calls to action. There are 2 or 3 here. I've got some feedback from our members that the 5 Calls app or ResistBot, those are easy peasy. If you want to reach out, to any of your state or federal elected officials, and those are the easiest tools I've ever seen. And I have received feedback, to thank us for that. The 5 Calls app has been provided through our relationships with Indivisible in the state of Georgia, also Indivisible National. Speaking of Indivisible National, they have agreed to do another $500 match for our group this month. So all of your contributions that go through that fund are matched dollar for dollar in the month of April, up to $500 for our group. We're well on our way already there. We should have just over $200 of that when I looked at the totals the other day, or earlier today. So, appreciate your help. Michelle is willing to to put up with me and our leaders and listen to all of our members' concerns, but she is on a paid basis there. So we would appreciate any of your support you can do for that. We do have some leadership meetings coming up. Those in the group that are kind of deemed in a leadership role. There's a call this Sunday. And then also Casey has been great to manage, our in-person meeting coming later this month at the Woodstock Library. You can do these things right now. I mean, you don't have to wait. You don't have to, phone a friend and ask them, what are you doing? Just act. I mean, these are tools that we have provided to all of our members, to complete our mission.
Robert, I'd like to add to that. So earlier this week, I was supposed to do that coffee video for you guys for the challenge, and I actually have a personal blog called Coffee Time with Michelle. So my entire life for fun is around coffee. I will forego my gourmet cup of coffee tomorrow, which is, let's just say, around $5, and I will contribute to your campaign. But if we all think about this legitimately, if we just don't go through Dunkin' Donuts, if we don't go through Starbucks, if we don't go through our local coffee shop just one day this week and forego our gourmet coffee cup and just go ahead and put on your coffee maker this week, but one cup of coffee and put $5 towards your cause where your Indivisible National is going to match you, I think your membership would be really proud about how much money they could raise. And all it is giving up one gourmet cup of coffee.
And I appreciate it. I'm bringing up a picture of Coke Zero. That's my coffee usually.
Well, give it up tomorrow.
Yeah, no worries. We're going to see where we get with the donations from everybody, but we're not going to let any of that money in the match go. We did it, and even more back in December when Indivisible National did it, and so I think all of our members are going to be right on board to do that for sure. And some of you as well, we're still trying to put an idea in our leadership group for a thank you. And we do have some tokens of, thank you that we can send out, which are usually tools in order to, complete our mission. So, the other thing too is, our group is different. Michelle, you mentioned several times it's diverse. We don't have to really get much permission from anybody to do much of anything. And that's what is unique about our group. Our messaging can be bold. We don't have to go to, within reason, because we have the state PAC and the super PAC. We can say pretty much whatever we damn well please. And that is what is different about our group. And if, there have been some discussions about the messaging and so on and so forth, but I'm confident that we have a good leadership group in place, and we'll be able to execute on a number of these different ideas for sure.
And I am on the outside, which I believe helps your organization because I see things differently without having a personal obligation to the group in any, I don't have a home in Georgia. I don't, I'm not in Woodstock versus another local city. So I get to sit on the outside and I get to view this from a different perspective. But your group is well organized, great membership. Each of you have different skills. My mentor taught me a long time ago, recognize your strengths, recognize your weaknesses, and fill your bench with your weakness. Your bench is stacked at GA11. There's a lot of very talented people. I believe with some structure, which is what we're going to get into the next 30, 60 days, I believe you guys can be extremely influential, that the next group of leaders going into 2022 are going to come to Indivisible Georgia 11 and seek your endorsement, seek your blessing on their future campaigns. And that's where this group has the potential to be. And I feel privileged that I get to be a part of it. And it is a beautiful thing to see democracy and work and to see all of you organized and wanting to make a difference in your government.
Yeah. So. And it almost felt like we were at church for a second. So.
Well, sometimes I go to church. I try.
All right. Well, thanks for doing this. Like I said, we kind of put all this together in less than, about 8 hours. But I like to do these. I like to do them at least bi-weekly, if not weekly. But we'll see where we can go with that. And there was a candidate, Rachel Kinsey. I'm not sure if you're still watching. Rachel, let's do one of these as well. I've been out on some different podcasts. There's a lady I still need to follow up with from out in Texas as well, who expressed some interest in coming on and talking about some of these things. This doesn't cost a dime. What we're doing right now is just simply spreading our message, and you never know who might pick up on something that we're doing here. So, any other parting words you can think of, Michelle?
No, I just look forward to doing this again. The more conversation we can have, the more informed everybody is, and the more lethal you are. So I look forward to doing this again.
I like that quote, lethal.
Yes, that's what we need to be. Lethal in 2020.
Cool. All right. Well, thanks everybody for joining. We're going to be able to take this recording if everything is good and put it on YouTube. Point to specific timestamps for certain conversations. But thanks, Michelle, for joining today.
No problem. Thank you for having me.
Yeah.